This video clip addresses commonly overlooked details by user that can lead to issues with quality checks or patient tests. Before we begin, I have two important announcements. Firstly, while the glucometer cradle is not connected to the hospital network, you must manually input results into the electronic patient record. We have no date yet when the glucometers will be connected to the trust network. Secondly, please be aware that the battery life of the glucometer is short. Avoid leaving it outside the cradle, as locating it during emergencies becomes challenging and a depleted battery renders the device useless. One of the most frequent problems associated with quality checks is the arrangement of testing consumables next to the glucometer. If you choose to retrieve consumables directly from the box, there is a risk of picking up random items instead of the intended ones due to potential distractions. This is the primary reason for the glucometers to be reported as faulty. To mitigate this issue, I recommend keeping a set of necessary consumables next to the glucometer. After each step, return any used test fluid to the box to prevent accidental reuse. Let's begin with glucose testing. We begin with the familiar login screen. After completing the login procedure, details regarding the type of quality control required will be displayed. Simply touch the QC button, and on the following screen, pay attention to the prompts at the top of the screen. These prompts guide you through the process. On the subsequent screen, you will be prompted for the solution lot. Always begin with the green bottle. Then, insert the strip, ensuring the glucometer remains flat on the table to prevent the ingress of QC fluid into the strip port. Apply the sample carefully, starting from the end of the strip to use the minimal amount necessary. Avoid applying the sample to the top of the strip, as it may not reach the sensor, and excess fluid will create a mess. After the test, you will receive a confirmation on the pass or fail screen. At this stage, transfer the level 1 fluid to the box to prevent accidental reuse. Repeat the process with level 3 solution, red bottle. If ketones QC is required, keep only keto strips and QC fluids next to the glucometer to avoid accidental glucose testing. A reminder, ketones QC should only be performed when testing a patient for ketones. No routine tests please. Another frequently observed incorrect user action occurs when a patient test is required. Following login procedure, the glucometer displays a screen indicating patient test at the top. The correct response being the green button located at the bottom. Simply press the green button to proceed and accept the prompt. Again, keep next to glucometer only intended test consumables to avoid errors. And happy testing!